I'm Jackie Pendleton. I'm the Chief Officer of NHS KERNOW. NHS KERNOW is an organisation that represents our local GP practices. We've got 59 of them across Cornwall and the Isles of Scilly. We're responsible for assessing the needs of the population and then purchasing, so buying services to meet those needs within the money that we're given by government. Oh, a whole range of services, from general practice itself in terms of the day-to-day stuff you're going to get from your GP practice, through to urgent operations, through to the emergency department at the Royal Cornwall Hospital or at Plymouth.
My name's Ian Chorlton. I'm a GP working in Callington in the east of the county, and I'm the chair of our governing body, which is our board of GPs and other members who want to assure ourselves about how well we're performing here in Cornwall and the Isles of Scilly. We're here for the people of Cornwall and the Isles of Scilly, and our responsibility is to provide the best service we can with the resources we've got. Much of the conversation over the last few years has been all about our finances and our awful financial position, and I'm really pleased and proud that this year it's been much more focused on what we do with and for our people, and working with our colleagues right across health and social care. So our finances have become less part of the conversation. It's around what can we do and how can we do it better. Well, part of the role of a commissioner is, of course, to make difficult decisions, but to be seen to be doing the best that we can with the resources that we've got. And by resources, I mean the people that we have and where they work. And people that work with people with health and care problems are not only healthcare professionals, are people working in the local authority, in care, and particularly the voluntary sector. We have a fantastic relationship with our voluntary sector. It's a really important part of living and being part of Cornwall. And what we've seen over the last year is how services are wrapping themselves around people and their individual needs in the place that they live, and that can't be met just by healthcare or just by social care, but it's met by us all working together and recognising what it is that individual people need.
KERNOW Maternity Voices represents the voices of women across Cornwall and the Isles of Scilly to help transform maternity care. So the voices of women and families are really important for the transformation of maternity care across the country, not just in Cornwall. And what we do is we go out to hard to reach places and also speak with women from many different communities to help get an equal representation of feedback to be able to transform maternity care for future families.
It's very much women-centred care. It always has been, but there's more emphasis nowadays on really listening to what women want, what their families want, and what they want from their labour and the birth of their child. So this was very much driven by the women of Cornwall. We always have had freestanding midwifery units, but they're outliers, so they're a little bit further away from the hospital. Women wanted somewhere that was midwifery run, but that was close or within the hospital at the same time, because we know that home births, if your pregnancy hasn't got any complications, are actually, it's the best place for you to be, but this gives the same home from home atmosphere as a home birth does, or as close to as it can. Parents absolutely love it. The minute they walk through the door and see the room where they're going to meet their baby, they are very, very emotional, and the feedback is always incredible. They thank the staff, they thank us for providing such an amazing space for them. Sadly, we can't open our doors to every single woman, but we are making, or we have made efforts on Delivery Suite to actually create the same atmosphere, the same calm, promote undisturbed birth as much as we can there for those women that sadly couldn't come to the birth centre.
I'd say this was my second child that I had here in the birth centre, and I had such a positive experience. I think I was surprised by how brilliant it was, really.
It's not just about being able to see GPs when they want, it's about seeing the right professional at the right time. And what we've worked with our colleagues right across general practice and primary care about improving access to primary care. And I think what the key thing I've seen here is that each part of the county understands the needs of their population in a different way, and they've come up with their own model, what works in their area for people to be able to access primary care when they need it out of core general practice hours.
So I've been leading on a project around personalisation for patients who have 2 or more long-term health conditions and maybe mental health needs, and trying to work with them in a different way, a more empowering way, putting them at the centre of their care and building a service around them instead of saying, this is what we can offer you. Okay, so it really varies. So some of the patients that I support have been in and out of services for many years, fallen through the gaps, and felt their needs hadn't been met. So some patients, for example, with personality disorders and long-term health conditions. So I see several patients with rare or unexplained medical conditions. And they felt very unheard, felt that they had, that clinicians aren't listening to them. So the most important thing really is about listening and hearing their story and giving them an opportunity to express what they feel they need and what would benefit their health. And then I will go and investigate what is, if any of that is available through commission services. What isn't available through commission services, I will then look into see if there's any other options with any of our partners in the community. And then there is the possibility of having a small personal health budget which will pay for them to access the therapies that they feel they may need.
Well, for several years now, people are able to have a personal health budget to be able to buy the care that previously we purchased on their behalf. It means there's no extra money for their care, but they've got a choice of how they actually get that care. So if they choose to do something different than having a care package being delivered to them by somebody for personal care, and they can manage to do that by their partner or managing to do it themselves, but slowly, they can choose then to spend that money in a different way by having hydrotherapy or going to a gym or going to art classes or anything that they're interested in that brings about their betters their well-being. The real difference in personalisation is having that conversation with them to find out what's important to the individual, and that's something we weren't very good at doing in the past.
I've had a personal budget now for going on for 10 months, 11 months. Yeah, I use my personal budget to make a personal plan for myself, what care I need, when I need it, how I need it, how it's administered. A lot more flexibility. We also have continuity of care, so we know who's coming in. We know they're fully trained. You go through that. Try a procedure, or say, for example, I want physiotherapy, and that would be the obvious thing. But if it didn't work, then as long as I could justify to the right people that I wanted to take on another treatment, then that budget would automatically go across to that. So yeah, I get the right care that I want and need.
Yeah. So pressures on A&E often make the news, and we see say winter pressures and increasing demand, and we've seen increasing demand in our emergency departments over the last year. But we've coped, and we've coped better than we have done in previous years, and that's really the reflection again of how we've worked collaboratively together with the best interests and needs of people. And we're setting up urgent care centres across the county, being able to provide people access for the care where and when they need it, rather than having to go to the emergency department, and looking at those alternatives. Develop some really cool and fantastic apps at NHS Quicker, which helps to point you in the right direction for care when you need it. So the urgent care has been a real focus of what we're doing. It's not been the only thing we've been doing. So long-term conditions, again, another of our priorities, and one where we've had issues and struggled in the past to be able to do what we want, and diabetes has been a key sort of focus of ours, and we've implemented some new programmes over the last 12 months so to help people before they develop diabetes, or in that period of pre-diabetes, but also to help people access the help and support they need soon after a diagnosis, so they can help look after themselves better. They're all really good and key things about what we want to try and help people look after themselves. Dementia has been an ongoing issue for many years, and we recognise that our performance there can improve. and we understand and recognise that we perhaps haven't found as many people with dementia as we would like, and we're working with our mental health providers and also our colleagues in general practice about how we can identify people as early as possible and then help provide them with the support that they need. And dementia has been a key target of ours, and certainly one that NHS England has helped work with us to try and see if we can improve things in that respect.
I'm a volunteer at 3 memory cafes and more when they are in need. The memory cafes are set up to help all those that have memory loss, whether they are diagnosed or by the doctor or not diagnosed. People will know when they have memory loss, and so they come along with their carers on a regular basis. They have a regular venue to attend so that they can easily remember it, and they are able to feel part of the community, to have fun, and that's what we call ourselves, fun, friendly and free. We are manned by volunteers. Everybody is a volunteer that is here to help them. We have a team of volunteers and they do all the little jobs that they like. Being part of the community is very important. And I guess that still there are stigmas attached to somebody with dementia, and we need to eradicate that totally.
Yeah, absolutely. I'd always lived a healthy life, and in latter years I'd always been warned that I might be pre-diabetes. Chose to think, well, it won't hit me, I'm immune from it. And then suddenly the old blood readings were going in the wrong direction, and I received a letter from my surgery inviting me to participate with a Living Well Taking Control programme. And that was the push I think I needed to help me through the pre-diabetes and getting myself out of the danger zone. Signed up for it, and within a month I was a full participant of the programme. And it's the support that's been needed, I think, for people like myself to go through the programme. It's more like a hand-holding thing, and I was with a group of about 12 people, all going through the same process. All various ages. I think the oldest gentleman was well into his 80s, and there were 2 or 3 younger than myself as well. But it's something I've looked forward to going to every time I've been along for the sort of regular visit, and I know I've benefited from it because I've had the weight loss, I've seen my blood pressure go down, and I've also seen my blood readings hit almost the normal zone. So it's been a good story as far as I'm concerned, and I've enjoyed it.
The work that's going on right from down in the west of Cornwall, things like the Bloom project and our approach to managing crises. And I think the extra 2.3 million that we've invested above and beyond what we've done in the past is a step up in the right direction towards what people talk about parity of esteem and being able to treat mental health problems just as the same as we would with physical health problems. We put work into our A&E department so that we can support people in crisis through A&E, and we're looking at some really new and innovative ideas around crisis cafes and how we can support people and help them to be more resilient so that they don't need to be admitted to hospital. That's been one of the great big successes over the last 12 months. 12 or 18 months ago, we were on average every month maybe 12 people were having to go out of Cornwall for a bed for acute mental care. I'm really pleased and proud to say in the last 12 months there's been nobody that's had to go out of Cornwall for an acute mental health bed. That's a fantastic achievement.
So it's a brand new building and service that's coming and opening this summer. It's a 14-bed unit for young people between the ages of 13 and 18 for people experiencing acute mental health difficulties. So it's the first inpatient unit in Cornwall of its kind. They make a huge difference. So previously what's happened when young people have needed admission to an inpatient unit, they've had to go out of county as far as kind of Scotland or Kent, and this has meant that they've been away from their families. And what we know is good for mental health is to still be linked to your community, your friends, your family, because those are all protective factors in your recovery. So they become quite isolated and away from all those things. So now we're going to be able to treat children locally which gives us so many advantages because it means that their family can come and access the support that will be available for them and can join some family therapy if they need to. Their friends can come and visit after school. We can keep really close links with their educational setting and help them there. And it also means that that flow in and out of hospital will be easier because we'll have really good links with the community teams. So hopefully we'll be able to get people out of hospital quicker, but also keep those relationships alive.
So Valued Lives is a one-stop shop to support people with their mental well-being. We support people that are in imminent crisis, and we start that process by having a one-to-one chat with them, finding out a little bit about who they are, what they do, what makes them tick, and trying to find something that we can then use to offer them a tool to support them in empowering themselves to make their lives feel a little bit better to how they might be feeling at the moment. So the Crisis Cafe side of Valued Lives is a stage 2 of 3 stages that we provide within the crisis service. Stage 2 is a lounge session where people have already gone through our stage 1 process, which is a one-to-one process. And the stage 2 is when they're feeling a little bit weller within themselves and are ready to kind of have a bit more peer support. So it's a great place for people to come and meet other people. Lots of people make friends with other people, and we just do open discussions and small workshops where we do different activities, whether it be painting or games or something around a specific subject. For example, we do the 5 ways of wellbeing. That's something that we work really closely with. But we also do resilience, anxiety, lots of different subjects for people to talk about.
The title Valued Lives is perfect, I said, because I was dead against it. I said, but you've gradually, I've gained your trust, I've got to know you, you've encouraged me, you've not judged me, and, they were so valuable to me. They got me to the point where I was leaving my home, I was going out with them for a coffee. They introduced me to the lounge. I only started coming last week, came last Thursday, last Friday, and loved it. The fact that I felt really proud. I've gone from being a complete recluse to actually, I'm back. I'm here again. And without Valued Lives, I couldn't have done that.
So I'm Louisa Forbes, and I'm the Programme Manager for the Enhanced Health and Care Home work. We have some challenges in Cornwall and nationally with an ageing population, and rarely do we have anyone that comes into a care home now who doesn't have dementia, long-term conditions, frailty, disabilities. So the people that we're looking after need a lot more care. They need a lot more nursing input, and combined with that, we have less care home beds and lots of challenges to meet those needs of those residents that are living in care homes.
Okay, so my name is Tamsin Gates. I'm the clinical lead on the Trevena unit at Hillcrest House Nursing Home in Loo. Our aim is to provide the best that we can for people who are living here at Hillcrest House Nursing Home so that they can live well regardless of their age or their condition.
There is so much great innovation and quality improvement that's going on every day in care homes, so I really see part of my role as to celebrate that and to share it, because the hospital can learn from what's happening in care homes, and it's also a great place to work.
Like everywhere else in the NHS in England, we have an ageing population, and again in Cornwall particularly, the population is kind of ageing. We're hitting that ageing challenge about 10 years ahead of the rest of the country. Added challenges in Cornwall are how far away we are from the rest of the country, and actually just the rural nature of our population. If you look at our population numbers and the actual square mileage that they're spread over, it's huge. So for us, it's how do you organise services in a cost-effective way that still make them accessible to people. I guess the money is always a challenge. We can't say it's not. Everybody would like more money, but we have an obligation to live within the resources we're given by government, and therefore have to make sure we spend every penny as wisely as we can. I'm really proud to work for NHS KERNOW. I've been here about three and a half years now. Came from I've worked in several other parts of the country, and we've done so much in the last few years to improve both the way we work. I've got a fabulous group of staff, and I've got some really fabulous general practice colleagues as well. Most of our GP practices are rated either outstanding or good by the Care Quality Commission, for example, and they're really, really keen to do the best they can for the people of Cornwall and the Isles of Scilly.